Hi, I'm Jasmine Brooks. I am in Term 2, Adult Health 1. I'm going to be performing how to insert a nasogastric tubing as well as irrigation. I'm a little nervous, as you see. Okay, so I'm going to check my patient's orders, and the doctor has ordered a nasogastric tube. It's going to be for suction to decompress the stomach contents that's causing him a lot of bloating and discomfort and nausea and vomiting. I'm going to also check for allergies. So the type of tube I am going to be inserting is a Salem sump, and that's going to be for the decompression. The Lorvain tube is actually going to be for feeding, which I'm going to use, but I'm going to pretend that it's a Salem sump for decompression. Alright, so I reviewed everything, and I don't see any time that he had previous nasal surgery, so I don't see any contradictions for him having any tube insertion. Okay, so I'm going to go ahead inside my patient's room.
Hello.
Okay, I'm going to foam in. Hi, I'm Jasmine Brooks. I'm going to be your nurse today. Do you mind if you tell me your name and date of birth?
William Jones, and May 18th, May 18th, 1997.
All right, Mr. Jones. I was about to say, when were you born? You're a little big for your age. Okay, so I have identified my patient with 2 identifiers. And Mr. Jones, I am going to have to insert an NG tube today. I know you've been having a lot of bloating and discomfort and a lot of nausea and vomiting. And we're hoping, the doctor ordered it, so we're hoping that it's going to decompress all those stomach contents for you and get you feeling a little bit better than you are right now.
Thank you.
All right. So I have everything you need. And I will have to warn you that the procedure is going to be a little uncomfortable, but it should make you have a lot of relief afterwards.
Okay.
So I have all my setup. I've identified my patient. Okay, so I need the patient in a half balance position for this procedure. And looks like we're in there. So Mr. Jones, I'm going to raise you all the way up. Great. So I'm going to remove the pillow so his head can tilt back for the beginning of the procedure. Alright, so I'm going to wash my hands again. And first what I'm going to do, I'm going to inspect his nares. So I'm assessing for any deviated septums or any blockages, any irritation or bleeding. I'm also going to check his his oral cavity as well. That was his nasal, his oral cavity as well. I don't see any loose teeth or any food or anything else in there. Now I'm going to actually include his nodules to check his breathing. So I'm going to include, can you sniff for me? Okay, that was good. Can you sniff for me? Okay, great. So it looks like both nostrils are good, and I'm going to actually insert the NG tube into his right nostril. Okay, so now that I've done that, I'm going to bring the bed up a little bit for me at a better working height, which is not that high because I'm short. Okay, great. So now I'm going to actually measure my tubing. So how I'm going to measure that, I'm going to use the next technique, which is going to be from the tip of his nose to his ear and down to the xiphoid process. So that is going to be my marker for my safe distance. So I mark that with a marker. That way I know just how far the tubing should be going. So now that that's marked, I'm going to perform hand hygiene and put on my gloves. Foaming, hand hygiene. Okay. Alright, so now that my gloves are on, I'm going to go ahead and lubricate the tubing. I'm going to throw this towel on as well to catch any gastric contents. Okay, great. So I'm going to lubricate my tubing about 4 inches from insertion site. Alright, so Mr. Jones, like I told you, it's going to be a little bit discomfort. I'm going to get you first to tilt your head back for me. Alright, we're going in. Alright, so now that I'm advanced, it looks like it reached the back of the throat. So I'm going to actually inspect the throat, make sure there's no coiling. Also, can you speak for me, Mr. Jones? Okay, so the client is able to speak, so we know we can proceed further. So now that we have assessed that, I'm going to ask you to tilt your chin forward while advanced. And you can either ask the patient to swallow for you, take sips of water, or swallow. So swallow as I advance, Mr. Jones. So we're advancing now. And if it was any gagging that occurred, you can just stop for a second and pull out just a little bit, allow the patient to rest, and then continue. So now that that is in place to my marker, I'm going to tape my NG tube to the side of his cheeks just so I can assess for placement. All right, Mr. Jones. So to assess for placement, I'm going to aspirate for stomach contents. And it looks good. But let's check the pH to make sure there's stomach contents. That's my pH paper. Back to the pH. It looks like it's about a 2.5, which is normal for gastric contents. So it looks like we're in the right place. But to be sure, I'm going to pull back some air. And I'm going to auscultate on my left upper gastric just to make sure that we are in the stomach. And I'm just going to pull this towel up. Okay. Bloop, 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 bloop. All right. So it looks like we're in the right place. Okay. Also, to check the placement, I can get my colleague to come in as well and do the same air bolus auscultation to make sure it's in the right site and he hears what I hear, as well as the patient would go for x-ray to verify placement. You can also verify placement by measuring the length of the tube from where it's out the nose there. That way you can know if anything pulls out or if it's in a different place than it was before. All right. So now that we've assessed and that it's in the right place, I can go ahead and secure his tubing to his nose. So, all right, so I'm going to do a crisscross using this Y. I'm going to bring that up here, crisscross the other side, bring it up there, and just one to bridge across the nose. Go ahead and take this one off the cheek. All right, are you okay, Mr. Jones?
Yes, that feels so much better.
Okay, and also if the tubing was in place, I would still just check again for coiling once it was in place before inserting the air. Okay, so I would hook this up to suction. Like I said, we're assuming that this is a Salem sump tube. So I will hook this up to suction on low intermittent. And I would assess for the amount of gastric contents, the color of it, and the consistency, as well as assess, document how the client responded to the treatment, the type of NG tube, the size, and the site which nair it was in. Also, I would, of course, assess for my P's, the pain position potty, make sure the client is in any pain. Actually teach him as well that if he does feel any discomfort or pain in that area, as well as continued nausea, definitely to let me know as soon as possible. It could be a possible occlusion in the line, or it might have got out of place. All right. So also before I hooked it up, I will go ahead and safety pin it to my client. That way he can have free room to move. So do a little slip knot. That way the client is able to turn his head without it pulling, but we have a secure way of knowing. So that's at this point, after it was secured, I would then hook it up to my suction on low intermediate, measuring the type of consistency, also recording the pH, which is the 2.5, which is the normal range, the amount, how he responded, the instructions that I gave him, as well as the size and the type of suction that it was. Thank you.